WeInfuse podcast episode number 8. Welcome to the WeInfuse podcast, where we take the confusion out of infusion, and each week we give you a behind-the-scenes look at the infusion industry, and we interview industry experts and thought leaders and practitioners so that you can know what it's like to be in the infusion landscape, how to simplify the whole situation and force best patient care and also reduce risk. In this particular episode, we interviewed Kim Blasengame. She was practice administrator with Kane Hall & Berry, a very high volume and innovative practice in Texas. And she gives a behind the scenes look at the challenges they faced, the breakthroughs and the creative outlook they had with infusion therapy, and really how their hearts were in it, how their hearts were really patient focused, and how that helped them in tough times and when they had changes. And so she's going to share some stories of a lot of the changes they faced that were unforeseen changes. There's no way they could have planned for these disruptions in their business model and in their patients getting access to these incredibly effective and expensive specialty biologics. And so that's what we're going to get into this interview. Let's jump right into it. All right. Like I said, we have a special guest on the show today, Kim Blasengame. Kim was a former practice administrator for Kane Hall Berry Infusion. They have a very high volume practice doing a lot of neurology patients. And actually, Kane Hall Berry was the first WeInfuse client. They were a beta client. So, Kim, thank you for being on the show.
Thank you for having me.
And we also have our co-host, the Mr. Reese Norris, with us today.
Hey, good afternoon. Thanks for having us.
So, Kim, we're really glad to have you on the show because you have a lot of experience in this space. And even before we got on here, you were sharing stories of Tysabri and all this stuff, and it's just really neat. But give our listeners just a little bit of background on you, kind of your experience in the infusion industry, where you started, what got you to here.
Okay, well, most of my experience has been in the independent practice space, physician practices and outpatient facilities. And I was with Kane Hall Berry Neurology since 1995, and we got into infusion first around in the early 2000s to serve our patients who had chronic demyelinating inflammatory neuropathies. We started out by infusing IVIG, and we really got it ramped up when we were anticipating Tysabri to come online to be approved by the FDA, which it was initially in 2004. So it was the first biologic infusion drug for MS. It was a really
it's an incredible drug. Yeah, very exciting time.
So
you've definitely seen some changes take place since then.
Yes, lots of new therapies come online.
Yeah, and I can't wait to share the story that you shared pre-show about Tysabri. What would you say today is, with everything you've experienced in the infusion practice and all the way out from the business side to the clinical side, and just helping all those moving parts, streamlining all those systems and pushing for best patient care, all the things you've been involved with, what would you say today is your main area of expertise?
I'd like to think that my area of expertise is being able to deliver value to patients and to the healthcare providers in an environment of tightening margins. So really for the past, I would say 7 years or so, it's been all about doing all those things and delivering that high quality care and doing it all within very tight margins. Tighter than what we were used to in the past.
That's for sure. Yeah, reimbursement continues to decline, and I'm going to put a plug in here for Kane Hall Berry. Not only were they the first beta client, but they've done a lot for my family personally and Brian Johnson's family. And so we're very thankful for the practice and Kim's leadership there. And Kim and the practice were early on supporters of the National Infusion Center Association as well. So Kim and her practice have been very just involved in the infusion landscape, trying to help form it. And we're just thankful that she's on today, but also just thankful for your passion that you bring to that center, and just your leadership there was instrumental. So it's been a great run, and we're glad to have her today.
Well, I was very thankful for Reese and for Brian Johnson early on. infusions, ambulatory infusion is really an emerging market. And as you remember, Reese, back in the day, there wasn't a society, there wasn't an organization, a national organization for infusion centers, and you guys recognized the need for that too. And it wasn't there, and so you and Brian went out and created it. And created the National Infusion Centers Association, which was a tremendous resource, and you guys were a tremendous resource.
Well, and I think that goes back to, we talked about this on one of our podcasts earlier, is, they had their own infusion center. We had ours, and we weren't that far apart. We were 10 miles maybe.
Yeah.
And so some people could look at us as competitors. But what we really saw is it was very synergistic. Mm-hmm. Some of our patients would go there, and vice versa. They would send us patients that, for whatever reason, they needed to refer out. And so I want to emphasize that too to our audience listeners, that there's a lot of strength in numbers, and you can learn a lot of best practices from each other. And I think when you have an infusion center down the street, don't look at them necessarily as a competitor. Yes, they are to some extent as well, but when it comes to collaborating around national policy issues, state policy issues, they can be your best friend. So
that's a really good point. And we get calls often from people who want to start an infusion practice, and they need tips on that, on things that Reese just spoke about. And we also get calls from people that have infusion practices. Obviously, they're interested in the software. And then the more they talk about the software, they realize how the expertise that Reese and Brian have. And then they want to tap us more for information and insight, to have somebody looking over your shoulder to learn about these things. And so that kind of brings me back to what you mentioned when I said, what's your main area of expertise? You mentioned pushing for best patient care, but in a business model with tightening margins, what are some specifics on that for people that don't know that? Maybe there's somebody listening that's interested in starting an infusion practice, maybe a provider that thinking I could start an infusion practice or whatever. What are some examples of those margins you're talking about, or?
Oh gosh. Okay. Well, ever since the ASP Medicare came out with the ASP, the average sales price fee schedule, back in, I think it was in 2005. The goal of that program was to create a 6% margin on drugs. So the ASP would gather data from the market and reported by manufacturers, distributors, and the idea was to figure out what the average sales price was for a drug, and then for the fee schedule to be that number plus 6%. And 6% is a tight enough margin, but as you know, it's really even tighter than that. So, there's kind of a cycle where, pharma pricing tends to increase and the ASP refreshes, once a quarter. But one of the biggest things that happened was that when sequestration came into effect for our Medicare population, it took, so that 6% margin, which was still kind of, iffy, it took 1.6% off that. So really the margin was 4.2%. And when you think about that, and you think about these very expensive drugs, one mistake, one missed pre-authorization, one non-covered drug, it's very hard to recover from that. And there's so much that goes into the front end of that, and making sure you got authorization from the carriers, and making sure you've got everything clinically set for the patient, all the I's are dotted and all the T's are crossed. And there was really, in the market before WeInfuse came along, there was nothing. I mean, there were no software solutions for that. And I don't want to beat up too much on the HR vendors, because they've had such great challenges too, keeping up with all the government change. Keeping up with all that has been really incredible. And we work with the Next Gen. Next Gen did an incredible job, has continued to do an incredible job of keeping up with that and allowing us to, draw those measures and report those, and we did very well on that. So they've been an excellent partner in that. But with all that, they just really didn't have the resources to develop, EHR support for this emerging market, for this emerging business line in infusion.
Awesome.
Yep, we talk to people about that too, and you look at with WeInfuse, and you look at how it can export all that nurses' data into like a billing note, and how easy that makes billing. And I showed a large practice that yesterday, and they said, wow, you guys are automatically converting those J codes to the proper billable units and all this stuff. And this is going to make billing so much easier and everything like that. And we talked about it for a while. You can make a mistake on the administration, but you make a mistake on one of those J codes and you're in trouble. I mean, if that happens 3 or 4 times a year, you could just totally eliminate your profit.
Which, Kim, that's a new feature. I don't know. we now take the nurse's note and we convert it to a billing note. But again, going back to what I said before, Kim even went to us before we could even do things like that within WeInfuse. So grateful that Kim took the time to allow us to beta the product in Kane Hall Berry Infusion. One of the things I was going to say too was to piggyback off Kim, whether you use WeInfuse or not, you brought up great points. One is you've got to have all your T's crossed and your I's dotted with a payer, whether that's pre-authorizations, knowing your LCDs, and if you're billing Medicare. And then now, not only are they authorizing the treatment, but then they're saying, okay, you can only treat this many times, or have this many treatments, or bill this many units before you need another auth. And so whatever system you're using, spreadsheet, notes in your current EHR, you've got to have those processes tight. To your point, you lose one of these patients, a Limtrada patient, you misbill or don't have properly authorized, or they don't have active insurance. It's devastating to a practice, or can be.
Yeah, it can be financially devastating. So the infusion business line, it's risky, it's challenging, but it's also some of the most rewarding work I did in that practice. I really enjoyed that. Really enjoyed being able to bring new treatments to patients. We kind of developed a reputation of being, the first to bring new treatments to market. And, the MS treatments have come along, they just seem like they got scarier and scarier. Limtrada came out with a 97% infusion reaction rate and, doing those things. But it's important to be able to bring those new products to the market and make them available to patients. And I've been really happy to have the opportunity to be a part of that. And
tell us about your journey. I want to go back to her journey. Kim, you were saying about Tysabri, and when it was launched, and just whether it was the reaction rates and whether it was just you guys navigating a brand new biologic drug in this space. Rheumatologists may have been used to giving Remicade, but neurologists didn't have a biologic drug at that point. So tell us about how you navigated that.
No, we didn't. So our only infusion experience up to that point had been Solumetal and IVIG. Mm-hmm. And Tysabri was approved by the FDA on the Wednesday before Thanksgiving, and I believe it was 2004. And we infused the first dose on November 30th.
That's cool.
It was cool. And it was infused every 4 weeks. But it had a high infusion reaction rate. And so about 20% of patients would have an anaphylactic reaction to the medication, which was really very serious. And I remember it was really a neat time in terms of collaborating, all the MS specialists across the nation. We did Biogen had arranged, and every either Tuesday or Thursday night, like 7, I think it was 7 o'clock, because I remember it was late in the evening, so everybody could get together in all the time zones, and they would all get together on a call. The guys at UT Southwestern and Colorado, and all the specialists would get together on the phone, and they were all talking about how they were going to solve this problem of the infusion reactions, and they were talking about what they were seeing with the drug, infusing the drug, and trying to get together the pre-medication protocol and how they were going to stop these reactions from happening. And they talk about this guy was going to try this this protocol, and somebody else was going to try that, and they'd meet back next week and talk about how it went. And I think it was the guys at UT Southwestern that finally kind of broke the code on the pre-medication protocol that we still use today that prevents those reactions. And so it was it was a really neat time, and we had patients that had been infused November, December, January, and then February 28th. We had patients that were coming in that day for their 4th infusion, and these patients, they were getting better. Mm-hmm. These were really severe. These were debilitated MS patients. They were having trouble ambulating, or they were in wheelchairs. They started getting this drug, and they started getting better. They started be able to transfer, to the chair on their own and they were really seeing the difference, and it was really a pretty magical time once we got past all the infusion reactions.
Right.
And there was such a community among the patients because they would all get infused together every 4 weeks, and it was a really neat time. And then that day, February 28th, we got the notice that the drug was being pulled from the market because the study patients had started dying.
Oh, I remember
from
this,
PML.
by the way. I absolutely remember.
Yeah,
Scary stuff.
from PML, and I remember everybody going, "What PML?" And I remember one of the docs in our practice running back to his library and pulling out his textbooks, going, "Okay, I know I learned about this in med school. Like, what is that?"
Yeah.
Just looking it up, and people try, "What in the world's happening?" And I remember that morning, we got notification like 7:30 in the morning. I remember the phones were going to come off answering service about 8. And I remember just kind of holding my breath to see what are the patients going to say, because the patients have been notified. I think
As
they're
well,
all registered. Yeah. And I remember sitting there and just feel like it was holding my breath, watching 7:58, 7:59, 8 o'clock. There it is. We turned the phones on, and the patients did start calling. I didn't know what they were going to say. I didn't know if they were going to say, "Gee, you talked me into taking this drug, and people are dying, and how can I didn't know what was going to happen." But the patients did start calling, but the conversation was very different, and I remember it was such an emotional time.
Oh.
We had 7 doses in the refrigerator. I remember this, and the patients started calling, and they were just begging, "Please, we'll sign anything, any kind of release, can I please come back? Can we please come back and have the drug infused? Like, we don't care. We know there's people, but it's making a difference in my life.
Yeah,
I'm getting my
wow.
life back." And they really wanted it. It was so hard because we had those 7 doses, and all these patients they were in tears. They were just, "Please, we'll sign anything, any kind of release, and of course we couldn't do it. It was the hardest thing, sending those 7 doses back.
Yeah, I know Dylan's probably going to ask you what the biggest challenge is. There's not many that probably top that. And for our listeners, and I was somewhat involved in the business at this time. Tysabri was a drug. I don't remember, but it was one of the first drugs for MS in a very long time. I can't even remember.
It was the first infused biologic, yeah,
for MS, and for to see the results that were happening with these patients and to have that taken away from them, I can't even imagine. But ultimately, I think again, that's talking about how advocacy can help. A lot of those patients mobilized, and then ultimately, basically force the government's hand to put the drug back on the market. So did you have any help in that, or were you involved in helping coordinating those efforts with your patients, or how did y'all handle that interim time period before it went back on the market?
I did. I don't think we coordinated any of that. The patients, MS patients they're advocates.
Absolutely.
I mean, they are, there's something about that group of people, and they have such a strong community, and they, I don't think they needed our help.
That's good.
I know it didn't seem like, but we were watching the data and watching the research, and we're so pleased that the FDA fast tracked that drug again and had it back on the market in 18 months. And of course, we had the patients all ready to go.
So it came back on the market in 18 months, but did it come back on with a REMS program?
It did.
Okay.
It did come back on with a REMS program, and that was our first experience with that. Of course, this was all a brave new world.
Yep.
I mean, ambulatory infusion, it just wasn't a thing back then.
Yeah.
And
especially
certainly not in neurology.
Yeah.
No, it wasn't. And we would infuse for other neurologist patients and things like, because, it was kind of, gosh, how to do this and and we're like, we'll take them.
Yeah.
We've always done that. We've always taken outside orders if there's somebody, even for the med school for patients that were in our closer to our geographic area, if that was helpful to them. We've always been willing to do that because, MS patients are, I don't know, there's just something about the MS provider community. It's like they're our patients.
Yeah.
There's
it's not my patient, it's our patient.
No,
yeah, absolutely.
Yeah, and that's always been a very cohesive group, people that serve MS patients.
And just for our listeners, the REMS program is now called the Touch program, correct? And don't you have to be registered as your infusion site? So if you're an infusion center wanting to treat a patient that's been prescribed Tysabri or Tysabri, you have to be part of the Touch program, which Biogen runs and facilitates, correct?
Yeah, they do. And
It's been a while since I've operated, but those details are still
it was a
in
good program. And, we talk about it was the first time that we dealt with anything like that. And then I remember just last year we had the first MS drug release without a REMS program. We almost didn't know what to do without that.
And that was Ocrevus?
Yes.
Okay.
That was released without a REMS program. We thought, what do we, because we had become so used to doing that.
Yeah.
It was really a great resource for us. They helped us. They provided a lot of support for us. Patients were registered through that. The patients had all the support, and there was tracking on everybody.
Yeah, it forces this accountability and this transparency, and this, everyone, and the data is all streamlined. So REMS programs from that standpoint are really good.
Right, and it also gave people a place. So if somebody wanted to prescribe, if they wanted to find an infusion site, they just check a box on the form, and the program would reach out and find match the patients up. And then, when we didn't have that anymore on this newest drug, we're like, wow, how's this going to work?
Yeah.
But it did well. That was a great drug. We infused the first dose in Tarrant County.
First dose of
Ocrevus,
wow.
Yes. And that was the first drug. That was so huge. It was the first drug for patients with primary progressive MS, which is a particularly nasty form of MS.
And ever or years? I mean,
ever. It was the first
wow.
ever treatment approved for primary progressive MS.
And I've read articles of patients that are just seeing just awesome results on that drug, and that's what infusion centers are doing. That, to your point, that's what makes this such a passion. So much passion comes to serving these patients. So it's awesome.
That's a great story. And so in the midst of all that, when you guys were navigating that, what's one nugget of wisdom you would want our listeners to take away from that story?
Oh, from that story?
Just going through all that with Tysabri and just the whole, that's quite a dramatic story.
Well, you really have to have your heart in it.
Yeah.
You really have to have your heart in it. And, it's not for the faint of heart. It's not for that. But it's risky, it's scary, but it's so worth it.
So worth it.
So worth it.
Yeah, we tell folks that reach out to us all the time that this, to your point, this business is not for the faint of heart. Yes, you're serving a need, and obviously, if there's an Alzheimer's drug which they're anticipating
always
being on the market, the delivery channel is just there's not enough capacity to serve it, and so there's a lot of demand. But to your point, the margins are tight. You've got to run a very, very tight ship if you're going to enter this business, and your heart better be with the patient, first, because ultimately that's what's the most important. So we try to say those things when we talk to our prospective clients, but do our best.
And the thing I want to say too about WeInfuse is it's not just a software, and I don't know if you want me to say this.
I do. We actually. That's awesome that you said that.
But
Thank you.
having you guys there, we've been doing infusion for a long time, and you guys came in and identified some things that we had missed, and like gosh. And the thing is that it didn't feel like a software vendor to us. You felt like a partner in this adventure with us. And really the beta testing time, that was a really cool time.
That was so cool.
That was a cool time. Oh gosh, the developers, you had the two guys,
Daniel and Alexander,
Yeah, we're in our Infusion Suite, hanging out with our patients.
That's right.
And, making friends with the patients, hanging out with the nurses, and, just watching the flows and seeing what they were, and listening to the nurses,
And then they would go back to the hotel that night and code.
They would take turns. They had the dogs.
Yeah.
They had the dogs at the hotel. They would take turns.
That's right.
They would go They would go back at night and do all that kind. They'd bring stuff back in the morning and roll it out to the nurses, and the nurses would look at it and go, I don't know, but they were right there with them, watching the workflow, so they could really see how they were delivering these services and what was important, and what information they needed, and really, I imagine they learned a lot.
Oh my gosh, of course, and it was so funny. So when that all took place, I remember calling my dad and be like, "Okay, we're going live at Kane Hall Berry, and the guys are going to come up from Austin, and we need to stock their rooms because they're going to be up. We're not going to sleep much." And so he went out. We went to Sam's and just bought a bunch of caffeinated drinks and lots of snacks, and they were set up well. And Brian Johnson, Alexander, and Daniel were there. So it was a good time.
Our patients were festive for a while after you guys left, because they were like, "Where's Alexander? Where's Daniel?"
Part of the family.
They were part of the family. They were all.
It's cool.
That is such a cool story.
So I hope it was a really cool thing
my
for
gosh,
them.
it was. I mean, we still talk about it. So I mean, you'll never forget your first client and the first person that takes a risk on you and believes in you. And so, thank you. It was a very, very fun time.
That is such a cool story. That's the first time I've heard that.
I still remember that phone call.
I know exactly where I was when I asked you if you'd be our beta client. I was at our.
Do you remember how that call went? What do you remember about it?
So I just remember I was walking through it, trying to put on a sales pitch, and then at some point you just go, "Yeah, we'll do it." And I was like, "No way!" She was like, "Yeah,
yeah." I remember that. That's funny you say that because I remember where I was sitting, and we don't really have like assigned offices.
Yeah.
Like I was in our Keller office, and it was kind of one of those one first come first serve kind of. You get the first desk, you get there on time. And I remember sitting there and talking about it. And I thought, oh my gosh, I can't believe that. But what was I going to say? But yes, I mean,
It was a passionate plea for me to say, like,
oh my
you know what we're doing?
I remember my people, when I told them what I was going to do, they were like, have you lost your mind?
Yeah.
And I said, well,
I don't know.
What are we going to do?
I don't know if the IT team there ever forgave us, but hey, we got it done.
What our IT director said, well, here's the thing. There's nothing else out there.
Yep.
And we need a solution. And I can't believe I remember him saying that. I can't believe I'm saying that. But okay, let's do it. Yeah.
That's
awesome.
It was a great journey. It was really, really cool.
That is awesome.
It was really cool. Those were good times. So.
So we were at this, we're in our Dallas office now, but we had a loft office in Richardson. So just imagine this really small room. That's a converted attic space is where I was officing at the time. And so that's where I was when I called you. So since then, we've now got some new digs. They're not, they're not huge, but we're definitely not in the attic anymore of a converted building. So we're moving up, and all to Kim and her practice taking the first leap of faith.
It was so neat to see you guys succeeding, and I watch the post and I see you rolling this out to new people, and then I hear stories like Iris think, oh my gosh. I called Dylan after that, and I was like, I can't believe I'm going to do a podcast. I can't follow her. That was such a great story. And this is what it's all about. People that have that kind of passion to really bring these services to patients and really do something. And oh my gosh, her stories were just so heartbreaking, and serving that Medicaid population, had not been served and didn't have access to care and didn't have access to drug, and getting in there, and I know how scary that is, getting in there like that, and just she hung around.
She just rolled up her sleeves.
Oh my gosh, what a brave woman! But there's a lot of brave people too. There's a lot of brave patients too out there, and
Amen.
It's been really neat, and since the early days of Tysabri, we rolled out other biologic infusion drugs even outside of our specialty. Because I guess once we kind of got the hang of infusing new biologics, we kind of got the reputation with the pharma as being a place to go, because they always have to have a delivery channel for those. But we were infusing for rheumatologists and for different people. But it's
that's
just
a good
really
point.
neat to see all that.
I want to tell our listeners that Kim had experience, yes, in the neurology space, but Kane Hall Berry Infusion treats patients from all specialties, so rheumatology, gastroenterology, and immunology, which not all practices do that. Some do, and I think you bring a unique perspective, because not only have you launched drugs in the neurology space or been around when drugs have been launched in the neurology space, but don't y'all do Actemra as well? So I'm sure you went through that launch.
And we had Krystexxa and Benlysta for lupus. And it's kind of a fun thing. We got to the Dr. Berry, our infusion medical director, and Debbie Hooper was our infusion manager. But and we'd get together, they'd roll out a new drug, and I'd be like, okay, guys, we got to learn about lupus, because we got the nurses together and everything. It's like, there's a new drug for lupus, and we're going to be the delivery channel.
Awesome.
And study up, and they're learning about RA, and the nurses love it. They go to the annual conferences, the CMSC conferences, and things like that, and they're really well educated in these areas, and they're like, hey, we got a new. We're going to learn about gout with Krystexxa. So
that's
I didn't even know that, but we had to learn it.
Yeah.
We had to learn it.
That's awesome. That's a good point for our listeners too, like how valuable conferences are. CMSC, WeInfuse attends or has attended the last 2 years. And we learn something every time. I mean, you're around not only your peers, there's great lectures. So we encourage our listeners to do the same. If you're in the neurology space, CMSC is a great one. There's a lot of great conferences. National Infusion Center Association will have its first conference this June. Just a shameless plug there. Yeah, so NICA will have its first conference in June 2019. So we're excited.
Oh, exciting.
Yep. So it'll be really, really, we're really excited about it.
That is very exciting.
But whatever conference you choose, make sure you attend those, and then typically they'll have some piece of infusion or a new drug or there's a learning opportunity at typically all these conferences, which is great. So.
Yeah, CMSC, the Consortium for MS Specialists, is the one that I've attended several years in a row now, and we treat multiple sclerosis patients, and there have been so many new things on the market. I mean, there's 14 different drugs on the market now. It's been really, so cool. It's been such a huge change. When I started in neurology, MS was, that was a diagnosis. It was like, gee, I'm sorry.
Steroids, and that's really it, right?
There just wasn't a lot that we were preparing them to just decline, and that was terrible. And when it just changed everything when these things started coming along, and patients were getting better. But the provider groups, the CMSC, it's really amazing camaraderie between the people that are running these MS centers, and you'll even see retired people. They haven't treated patients in 5 years, but they're still coming because maybe they're not practicing anymore. Maybe they're 80 years, but cool. So many of them, it's like they're still coming because it's still a passion.
That's really cool. And we saw that each year we attended. It's really neat. So
it's a neat thing. So
those conferences are great. And if it's one of the big national conferences, stop by our booth. We'll probably be there.
You guys are always there.
WeInfuse is there. That's right. You'll see it on LinkedIn. There's no need to see it secondhand. Just stop by the booth. Well, tell us this. Let's maybe just share another story, a short story here with all these experiences you've had. What's a big light bulb moment you've had being in this specific clinical setting where you have this unique factor of you've got this amazing clinical setting, but you also have this business side with these tight margins where you can't make mistakes. What's been one of the biggest light bulb moments in that context?
I thought about that a lot, and I don't know. Light bulb moment, I guess it's just, I don't know if it's really a light bulb moment, but, coming to that realization that's like, it's really worked well for us. It's like you always just have to do what's right for the patient first, then be really watch those margins, know your numbers, hire good people, develop them, engage them where they feel like it's their own. And then, the financial success will follow. It gets scary from time to time, but you can't lead with that in mind, the financial success in mind. You have to lead with serving patients first, and with these tools, and certainly with WeInfuse and you guys to support, that's certainly a great foundation for success for anyone.
And that it's so good because that's our passion, is enabling providers to focus on the patient side and not be snagged or weighed down or stressed out about the financial part and all the moving parts and all the gears in the machine of the business side of it, because our software platform and our, what WeInfuse tries to bring to the table is just the ability to simplify that whole process so that the nurses can focus on those patients and not worry about, did I calculate the right amount of wastage, or did I make sure I got, did the billing team get all the process done in the benefits investigation process? Well, we want to simplify that so you can focus on the patient. Yeah. And so it's just great to hear you reiterate that, because that's supposed to be the focus at the end of the day. And you just shared some amazing stories. I mean, patients begging for these therapies because it changed their lives. And so that's why we're all in it. So it's so great. There's so much we could share. There's so much more we could cover.
And I'm encouraging Kim. She wrote a great article that I was able to read. She brought to our office today. And I'm encouraging Kim to share that on her LinkedIn profile about the future of her vision for her practice. But ultimately, I think it could be a roadmap for a lot of practices, value-based care, and patient-reported outcomes. There's just a lot in there that there could unpack. So follow Kim on LinkedIn and get a glimpse of that article. It's going to be really good.
That's great. Yep, and I'll remember to say that. How can people get in touch with you after this? Remind me to say that if I don't say it. What's one last parting piece of advice for our listeners?
Oh, gosh.
Patient first, right?
First. Yeah, I think we covered.
It's hard to distill it down to one thing,
I think
right?
we covered it all. You had asked a while back what was my light bulb moment. I thought, oh, what was that? I think I know there was one after we had implemented the WeInfuse product. We were still going through developments and things like that, and the nurses were still and then one day Judy Beck asked the nurses. She said, "Well, if you had your choice to go back to the way you did it before on paper or whatever, what would you do?" And she said, "Oh no, no, I'm not giving it up. I'm not giving it up. No,
That's a good question.
And I said, no, we're keeping this."
Good.
So that was a great moment.
Well, Judy brings a lot of wisdom with her.
She does.
She's awesome.
She's wonderful. You guys have a really great team.
Well, thank you, Kim, and thank you for joining us today. We're super thrilled to have you, and I mean, there's not many folks that have been on the cutting edge of infusion, to your point, since that dates back to the early 2000s. So thank you so much for your time today.
Thank you.
Yep. Thanks for being on the show. And again, we can connect with Kim on LinkedIn, Kim Blasengame. Check out that article she wrote. And again, thanks for bringing your expertise to the podcast, because we really just want this to be a resource for anybody involved in the infusion practice. And I know a lot of people got inspiration and some helpful knowledge today. So thanks a lot.
Thank you.
Thank you.
And that's it.
See?
All right, that concludes our interview with Kim. And as you can see, the infusion practice is an ever-changing landscape, and you have to be ready. You have to be creative. You have to be flexible. And if your heart is in it, it is a worthwhile endeavor. Of course, it's a great business model. It's one of the best delivery channels for life-changing therapies. And I hope you got a lot of value from the things that Kim shared. If you haven't done so already, definitely check out our website, WeInfuse.com. We have free resources. We have very insightful blog posts written by our founders that have to do with billing, with the latest cutting edge issues in infusion therapy. And if you haven't done so yet, definitely schedule a demo of our software. You can schedule a short 30-minute call just to kind of assess the needs of your infusion practice to see where there might be some gaps in the process. And then if that's a helpful conversation, you can move on to schedule a demo of the software. We'd love to hear from you and help you to streamline your infusion practice. Thank you for joining us, and we will catch you in the next episode.